Welcome to the second video lecture series. So what I want to do in this video, and what I want to keep doing in all the videos, is focus now on the stages. We're going to talk a little bit about the stages of birth, and I want to go over this because every semester there seems to be some confusion about what happens within the actual stages of birth. Some people even argue with me about it, but this is biological, so I do want to cover that first. And then just mainly some terminology, especially for you pre-professionals that are going into some of our medical programs. Just some terms that you need to be familiar with, just in case somebody in your career asks you these questions. You know, it's always informative to give them kind of the scientific term, but then kind of explain it just a little bit so people have an understanding. And then talk a little bit about infancy. And some of the things that we see in the brain, some of the biological development, some of the cognitive development, and then, of course, some of the emotional development. So I'll try to kind of just do a synopsis of what you are reading, kind of just add to your reading. And what I think I'm going to do with the videos is do it by stages. I think that would be the best way to present it. That way, you know, somebody asks you a question in your career someday about, you know, my child, my adolescent, my young adult, you can kind of focus in on it. That's actually, and I think I've mentioned it before, how I look at the human lifespan. I look at it through stages, and I even think ages. So when somebody says my child, I say, whoa, what's the age of your child? Because I do compartmentalize like every single stage, and that's the way I've learned it. Because that helps you to think, okay, between the ages of 1 to 2, this is what's happening. 3 to 4, this is happening. You know, if someone's middle child and they're looking at that, they have a 9-year-old and they ask me a question, I can kind of compartmentalize the information from a biological, a cognitive, and an emotional perspective. And so if you can keep it to that and kind of put it together in your mind that way, I think it's going to help you in the future to remember all the material that you're learning. You know, the thing about human lifespan is just so much information. You know, it's so different than my abnormal psych class where we learn just groups of different disorders, and you can put it and lump it together that way. And then in my general psychology class, and some of you have me for general psych, you know, every section is a different topic. So you only have to memorize, well, memory, and then learning, and then personality. Human growth is everything. It's every single topic in psychology, every theorist, all lumped by stages, so it can be a lot to memorize. Okay, so here's some things I want you to remember now that we're getting into the birth stage. So let's do this birthing stage, okay? This is mainly to the first child. Once your body goes through a birth and your body doesn't know what to expect until it goes through it, it can be different from the second, third, and fourth child. Some of you are mothers out there, so you're probably going, yes, I understand. But for the first child, we look at the first stage of the contractions and the birthing process. Labor, of course, is contractions of the uterus. And what a lot of people maybe misunderstand is that your body starts to prepare for that weeks before you actually give birth. We call them Braxton Hicks. And so you may think that you're going into labor because you feel like, oh, wow, what's that? But it's just your body preparing that child, and everybody, you know, your uterus and the baby getting into the position that it needs to go into. So according to the first child, this is just the research that I'm giving you, it can last up to 12 hours. And again, everybody is different. You can't just put that time and go 12 hours. It could be more. And if you're taking other things, like for me, I had an epidural, sometimes I can slow the process down. So even though they say up to 12 hours, if you have any other type of method of delivery, then that can change the process. Now here's where students get confused. When the child's head reaches that cervix, we call it crowning. Some of you guys know this. In fact, they can even feel the baby's head. Once the baby's head moves through that cervix into the birth canal, stage 1 is done. Now here's where students tend to get it wrong every semester. you must be dilated. You must already be dilated. Some people write on the answer on the quiz, the first stage ends and the second stage begins when you start to dilate. Oh, no, no, no. You need to be dilated when that baby moves through the cervix into the birth canal, about 10 centimeters, okay? It's going to be very important. Now, once the baby's head moves through the cervix into the birth canal, this stage can last up to an hour. And again, everybody's a little bit different. Sometimes the baby just comes right out. We hear all those stories all the time. Stage 2 ends with the emergence of the child. So once the baby's head moves through the cervix, you're dilated, and the baby emerges. Stage 2 is done. You're done. Stage 3 begins. This can last anywhere from 5 to 30 minutes, and this is where the afterbirth placenta, everything else comes out. Now, I've had some questions in class, and we actually talked about this last week. There's a process, and they will ask you if you want to keep the umbilical cord, and some families have. They can cryopreserve the umbilical cord because it's loaded with stem cells. And so when you think about the research in the future, this might be something that could be of value. So they'll ask you ahead of time. Also, if you want the placenta, I've had students say, hey, my friend kept the placenta. I said, yes, I've heard of that too. I even had a student that had a friend that did that. She had her placenta made into pills because there is some anecdotal information out there that this might be beneficial, especially if you're breastfeeding. And again, I think it might be anecdotal. So that's the stages of birth, but there's different methods of delivery. Now, here's a question on the quiz. Most infants in the United States are born in hospitals. That's just the percentage. And that's really neat to look at other places. In fact, I had my students the other day say, pick a country that you've always wanted to go in a culture, and I had them look up what is the method of delivery in that culture, in that country. Some people put France, Norway, Iceland, Singapore. I mean, they just looked all over, and believe it or not, a majority are born in hospitals. It's the safest. So that's something that could be asked of you, and something that you might need to know. Now, we do have midwives. We do have midwife practices. In fact, I think over in one of our cities close by here, there's actually a midwife center. So some people choose home births. Home births are there. Some people choose water births as a method of delivery. So you may be asked, and so it's good to know that it's not just a hospital. Somebody may ask you, well, I heard about water births. What is the research on that? And again, I can't emphasize enough to use the research to support all of your responses. That's so important, and that is how I present it. If somebody says, I hear about water births, what do you think about that? I'm going to go, here's the research that we have so far, because you're giving that information to these individuals, and they have to make that decision. Okay, now some terms that I want you to know. If somebody says to me, I just had a baby, I do say when. Because if they say 2 weeks ago, I will say a neonate, because the first month is a neonate. And think about what's going on. The fetus was in a closed environment, and when you give birth to this child, now it's transitioning into a completely different environment, and the human infant needs to transition from this closed, protected environment to this open environment. So here are some terms that I want you to know. First one I want you to know is fontanelles. Now, some of you may know it. If you need to translate this that's a fancy term, but translate it to somebody else. Let me look at my time. Okay, 8 minutes. That is the soft spots in the child's head. So the skull is not fused. And if somebody says, well, why do they have these soft spots? This helps the baby's skull to move through that birth canal. Some people don't know that's the actual purpose of the soft spots in the head. That will fuse together, but that tells you again there's that transition from that closed environment to that open environment. Lanugo. Now, to translate that to individuals, you say lanugo, that's the fuzzy hair. We're actually born, we're mammals with fuzzy hair all over us, and that's a protection for neonates that actually helps them to regulate their temperature, their body temperature. Now, I want you to keep that word in mind, But when we get to adolescence, we're going to discuss some of the issues that we have in adolescence, even in my field. I've worked actually with eating disorders, anorexia, bulimia, binge eating disorder, and I've seen the later stages of anorexia. I've seen patients in that late stage, and their body is having difficulty maintaining a body temperature. They're cold all the time, and believe it or not, their body can actually regrow that lanugo. So that tells you it's kind of that biological protection. Now, the last one I want you to know is the vernix caseosa. The vernix caseosa is kind of this basically protective oily covering that is on the neonate. Now, somebody asked me, should you bathe them as soon as you get home? No, we'll just slow down with the bathing, because they actually have that protection that protects them against basically infections and their skin drying out. So you don't need to scrub them down and then just reapply all the stuff, the lotion right back on them. That oily substance helps to protect them against infections, and also it will dry out and it protects their skin as well. So those are the three terms. Make sure you know fontanelles, make sure you know lanugo, we'll bring it up again, and then also the vernix caseosa, and again, it's that oily. And you may be asked those questions, so make sure that you know that. Now, I do have a couple of questions and this information on the two scales that your infant will go through before they're discharged out of the hospital. So just be familiar with the Apgar scale. That's mainly biological. Think of the Apgar as biological measurements, and then think of the Brazelton neonate as more of a behavioral analysis before the child is discharged. So just keep those two in mind. All right. As far as some other areas that I want you to know, I do want you to know, and some people get this mixed up as well, is let's look at low birth weight and let's look at preterm. Okay, so when you think preterm, you're going to think between this time frame of 36 to 42 weeks. Now we give, or 37 to 42 weeks. If the infant is born before that 37th week, he is actually considered preterm. And again, that determines the week. Now, the low birth weight, if your child is low birth weight, this is, 5.5 pounds and less. Very low birth weight, 3.5 pounds less. But there's another term that a lot of people are not familiar with, and this is small for date. So here's an example. Say, for instance, you gave birth right at your due date for, let's say, 40 weeks. And your child weighs 6 pounds. Well, your child is going to be measured against 90% of the other babies that have been born at 40 weeks. Now, what is the average? The average in just the United States, about 7.5 to 8 pounds, about 21 inches. So if your child is maybe 5.5, 6 pounds, he's not preterm necessarily, because if you gave birth at 40 weeks, that's gestation, and so they'll measure that. So if your child is 6 pounds and 90% of the other babies born at 40 weeks are 8 pounds, then that is considered small for date. So just kind of keep that in mind as well. Okay, and also too, I think I have some questions on sudden infant death syndrome. Let me just say about sudden infant death syndrome. The first symptom is death, and it is a leading cause of death the first year of life. Now, are there some critical periods? Some research indicates that certain months, a certain time frame months, may be critical periods. There has been some recent studies, and I think they mentioned it in your readings, where they are specifically looking within the brainstem of infants that died from sudden infant death syndrome. And there's been some fantastic research that's been going on. Now, if you had general psychology, you know this information. But as far as how your brain is structured, because we're going to be getting in the brain, your brainstem has mechanisms that are built ready to go. Think of your brainstem as the biological mechanisms within the human brain. And within that is something called the medulla. In the medulla, if you watch Waterboy, the medulla oblongata. That medulla is responsible for all vital life functions, including breathing. There's another mechanism called the reticular formation. And the reticular formation actually works with the medulla as well. And one of the main functions of the reticular formation is alertness. It alerts you. It's arousal, so to speak. Well, recent research is looking within the medulla and specifically looking at the neurotransmitter, and you guys will know this, serotonin. Because as you know, serotonin does a lot. It regulates our mood, it regulates our eating, and it also regulates our sleep. And so what they have found, just some recent studies, is there may be some abnormalities in the postsynaptics when the serotonin goes to the other side. There may be some abnormalities there that the infant stops breathing, but the reticular formation is not functioning as well. So there's just been a lot of neat studies with SIDS, but just be familiar with that as well. Okay, so that kind of covers a little bit about when I talk about the birth stages are the most important, and again, those terms, a little bit about sudden infant death syndrome. Okay, so let's look at a little bit about how infants grow. I'm very surprised that a lot of people know more about how their puppies grow than how an infant grows. So 2 words I want you to be familiar with, and then you can translate it how you want to someone else. Cephalocaudal, proximal distal. So be familiar with those 2 terms. Now with cephalocaudal, I want you to think of cephalocaudal is from the head to the neck to the shoulders to the trunk. So basically top to the middle. Proximal distal is from the trunk to the shoulders to the extremities. So some of you know that you have to support an infant's head when it's born, because everything else has to grow and strengthen to be able to support that head. And then as far as the control of the extremities, as proximal distal growth increases, so will control of the extremities. So the fancy words, cephalocaudal going all the way down, then proximal distal going out. So be familiar with those 2 terms as well. And that's kind of the information that I want you to know as far as the physical development of an infant from neonate to infancy. Now, some of the things I want you else to be familiar with, and some of you guys actually know this, is a little bit about nutrition and breastfeeding. I do actually get questions about breastfeeding, and there's so much information out there. I think I printed something off a few years ago that's 101 reasons why to breastfeed, and you may be asked this question. You pre-professionals may be asked this question. And that's always been kind of the issue. First of all, there's been research that shows that breastfeeding is very beneficial for the infant. Now, there's a little misleading statistics in your chapter. Maybe they just didn't catch this in the editing, so I want to clear this up for you. The American Psychiatric Association recommends that you breastfeed for a year, but at least 6 months. Now, in your readings, it has at least a year, at least 6 months. That statistically doesn't work out, but they do recommend a year if you can. And an infant, a human infant, can actually survive off breast milk for a year, and then at least 6 months. The benefits that they have shown based on research and looking at infants, that it does actually maybe reduce SIDS. So it may actually reduce SIDS. It helps in the future for ear infections, respiratory infections. It helps with digestion. So you can see all the benefits. But there's also been some research that indicates that if you breastfeed your daughter, that may reduce ovarian cancer, and maybe even reduce ovarian cancer in the mother. So you can see that there's some really good benefits to actual breastfeeding. And again, it's not to say that you might not have to supplement, and due to your own personal lifestyle, you may have to actually go to supplements, but they do encourage that you do breastfeed, and it appears to do future help to the child, and that's what the research, breastfeeding now, what are the future implications because you breastfed with that child. So you may be asked. Be familiar a little bit with the brain. I think your readings go over a little bit with the brain, so just be familiar with the lobes and be familiar with the synapses. That's important. But here's a word that I want you to keep in mind, because we're going to talk about it when we get back into later adulthood. Oh, I'm already at 19 minutes. Lateralization. You have to think of it this way. When the infant brain is born, there's a left hemisphere and the right hemisphere. You guys know this. And they have to learn to talk to each other. It's something called maturation. And you'll notice in the first year that the child will start to lift it'll lift up a little bit, it will start rolling over, it'll start crawling, it'll start walking. But the left hemisphere controls the right side of the body, and the right hemisphere controls the left side of the body. they actually have to communicate with each other. And at first they're not. You'll see infants try to stand up and infants try to walk and they go right over. Somebody has to make a decision who's going to walk first. Some of you may even have this problem. You go to walk and you fall. So the brain has, through lateralization, has to learn to communicate with each other. The left side is like, okay, let me go first and you take a right step. Or the right side goes, well, let me go first, you take a left side. Have you ever thought about, like, when you get up, what foot you start off on? So they have that lateralization is very, very important, and they learn to communicate more and more. The left and right hemisphere learn to communicate. When we get back to late adulthood, you'll see that starts to change. And so the left and right brain are not communicating like they would in the beginning. So just be familiar with that, and be familiar with a little bit of the neuron as well. So I'm already 20 minutes. Okay, you know what? I think that this will be good. I think I'm going to do another video when I talk about cognitive and emotional. I think that should just be a separate video, but I hope this gave you some information. At least watch this one, and I will try to, I have a meeting, but I'll try to throw in another one that deals with Piaget, because I like Piaget. Even though my man is Vygotsky, I would definitely talk about Piaget and a little bit about emotions. Some of you have watched Inside Out. I still need to watch that, but let's talk a little bit about emotions. But that should give you enough. So what I've talked about, think about it, go back and read it, and I hope that gives you some good information. Those terms are very important. For you pre-professionals, they're very important, and I will do another video for infancy cognition and infancy emotion. All right, bye.